Hello, I am Dr. K, your health guardian. When was the last time you checked your blood pressure? And if you've heard that your blood pressure is usually high, please pay close attention to today's video. Recently, the American Heart Association and the Heart Society announced new guidelines on hypertension. These guidelines include some surprising information that differs slightly from what we previously knew. Today, I will explain this new guideline in an easy and fun way. Why is blood pressure important? First, let me briefly go over why blood pressure is important. High blood pressure is often called the silent killer because it usually has no noticeable symptoms. However, when blood pressure is high, it pushes against the walls of the blood vessels too forcefully, putting strain on the heart and blood vessels. It's like sending water through an old hose with too much pressure. In this case, the blood vessels get damaged, and the heart has to work harder, which decreases efficiency. If this condition persists, the risk of heart attack or stroke increases sharply. And it even raises the risk of kidney disease, type 2 diabetes, and dementia. Recent studies have further emphasized the connection between dementia and blood pressure. In fact, nearly half of American adults are said to have blood pressure higher than normal. This means it's an issue that we all need to pay attention to. 2. New blood pressure guidelines. What has changed? Now, let me tell you about the most important changes in the new guidelines. Normal blood pressure is defined as less than 120/80 millimeters of mercury. Elevated blood pressure is between 120 and 129/80 millimeters of mercury. However, if your blood pressure is 130/80 millimeters of mercury or higher, it is classified as hypertension that requires active management. Previously, medication treatment was considered for blood pressure above 140/90 millimeters of mercury, but now that threshold has been lowered. In other words, it means that medical professionals are much more actively treating hypertension than before. This change carries a strong message. Let's manage hypertension early for more people to prevent cardiovascular diseases, strokes, kidney diseases, and even dementia. A new approach to hypertension treatment. So what should we do when blood pressure is above 130/80 millimeters of mercury? The new guidelines recommend the following steps. Improve your lifestyle first. If your blood pressure is between 130 and 139 millimeters of mercury, it is recommended to prioritize practicing healthy lifestyle habits. This includes maintaining a healthy weight, a heart-healthy diet, reducing salt intake, and managing stress. Try to maintain this effort for 3 to 6 months. And only if your blood pressure does not decrease should you start medication. Compared to the previous guideline, which recommended starting medication and lifestyle changes immediately for blood pressure above 140/90 millimeters of mercury, it is clear that the importance of lifestyle changes is being emphasized much more. 2. No alcohol. And another important change is here. In the past, it was said that men could drink up to 2 glasses a day and women up to 1 glass without any issues. However, the new guidelines present not drinking alcohol as the ideal goal. This is largely due to the increasing evidence that alcohol has a negative impact on blood pressure. If you must drink, it is advised that men limit themselves to less than 2 glasses a day and women to less than 1 glass. 3. Dietary management. Avoid salty foods and increase potassium. Dietary management is being emphasized once again. Have you heard of the DASH diet? A diet rich in fruits, vegetables, whole grains, fish, and beans, while low in fats, sugars, and saturated fats, is said to be very effective for managing blood pressure. And our beloved salt. It is recommended to limit salt intake to less than 2,300 milligrams per day. And if possible, to reduce it to 1,500 milligrams. One of the easiest ways to reduce salt intake is to use potassium-rich salt substitutes. Low-sodium salt can be used as a salt substitute, and using herbs or spices instead of salt is also a good option. 4. Weight loss and women's health. Weight management is key to treating high blood pressure. New guidelines recommend losing at least 5% of body weight for those who are overweight or obese. And in cases of severe obesity, considering medication treatments like GLP-1 or even surgery. Finally, it emphasizes that blood pressure management is especially important for women who are planning to become pregnant or are currently pregnant. High blood pressure during pregnancy can pose risks to both the fetus and the mother. And it can even lead to hypertension after childbirth. Yes, today we explored the latest guidelines on hypertension together. The new guidelines remind us once again of the importance of healthy lifestyle habits rather than simply relying on medication. Of course, developing new habits can be difficult and challenging. But remember that consistent effort can protect our heart, blood vessels, and even brain health. So how about starting with small changes from today? If you found today's video helpful, please subscribe and like, and set up notifications. If you have any questions, leave them in the comments. I will return with more useful health information next time. Thank you.